This is a manual therapy technique for my patient here who had an open reduction internal fixation of the right radial head, type 2 Mason's fracture. Um, so at this point, um, we have done some active and active assistive range of motion. We've gained full elbow flexion and extension range of motion, or at least we had wanted to at this point, 3 weeks in. Uh, if we've noticed any deficits in that full elbow flexion or full elbow extension range of motion, we can incorporate some mobilizations in here. So now we're at week 3 and we're not seeing full elbow extension range of motion. So I'm going to demonstrate a manual therapy technique that will hopefully help us get some further extension range of motion. So I'm focusing my treatment at the humeral radial joint. And essentially all I'm going to do is make sure that the joint is in the loose pack position, full elbow extension and supination here. I'm going to stabilize the humerus. I am going to put my proximal hand on the radial head and I am going to apply a dorsal glide backwards. So stabilize the humerus here, come off onto the radial head, and I'm going to apply a dorsal glide into tissue resistance. So looking at that grade 3, grade 4 mobilization. I go ahead and do this for 5 to 6 minutes, and hopefully after treatment we can see immediate increase in elbow extension. We would further increase or include this treatment with other active range of motion activities to further increase range of motion. Could also do make sure that the scar is healing effectively, do some cross friction massage on the incision site as well.